road safety. Together, let us unite our efforts, harness our collective expertise, and implement bold, evidence-based interventions to save lives and ensure safer roads for all. Thank you very much, ladies and gentlemen, for your attention.
Thank you, Doc. Appreciate it. And great encouraging words. I know we'll have a plenary session where we'd want to engage further with you as well during the panel discussion. Ladies and gentlemen, at this point in time, we're honored and glad to have representation from the Ministry of Health as well. Something that Bright mentioned about the call for partnership between government, private sector, NGOs in tackling matters to do with road safety. So it's an absolute pleasure that I invite on stage Dr. Isaac Bashir, who's the Director of Family Health of the Ministry of Health. He's ably representing the Principal Secretary Medical Services, that's Mr. Harry Kimtai. So it's over to you now.
Distinguished guests, ladies and gentlemen, good morning. My name is Dr. Bashir Isaac. I head the Directorate of Family Health in the State Department of Medical Services, where prevention of violence and injuries lies as a program. As you know, the situation in the country, so our PS had sent his apology, but this falls within my docket, and therefore I will represent him ably here. Allow me to read his speech. Let me take this opportunity to welcome all in Nairobi, Kenya. I'm delighted to join you today as we launch the Africa Regional Road Safety Status Report. Indeed, road safety is a public health concern, and our collective responsibility is crucial in addressing this rising yet preventable burden. With strong and sustained multi-sectoral engagement, the SDG 3.6 target of having the number of global deaths and injuries from road traffic accidents can be advanced. Strategies and policies that are designed using evidence have proven to be not only impactful, but also sustainable. It's for this reason that I want to congratulate the World Health Organization and fellow member states for providing data that can be used for decision making. The onus is now on us to translate the findings into effective laws, regulations, policies, and actions, and most importantly, implement them effectively. As we plan for the road safety, it is imperative that we embrace technology and employ strategies that are in line with our population dynamics. Segments of the population who are particularly vulnerable, including children and pedestrians, should be provided with additional preventive interventions. I am cognizant of the fact that routine data for road traffic injuries remains a challenge in most of our countries. Lack of harmonized data from the health sector and the police, underreporting, and poor quality data are some of the reasons that have led to the adoption of ineffective options instead of investments in effective actions. The African Regional Global Road Safety Status Report provides policymakers, the public, researchers, and the development partners with an up-to-date, comprehensive, evidence-based assessment of Africa's performance in road safety. Further, it is beneficial that these reports are done periodically, hence comparison over time is possible. This means that member states need to be in a continuous state of improvement, and this is further compounded by the fact that 92% of the road traffic fatalities occur in low and middle income countries. The time to act is now. Ladies and gentlemen, Road traffic injuries are ranked 9th as the leading cause of death in our country. Besides these deaths, hundreds of thousands are seriously injured, suffering long-term impairment and lifelong disabilities. Those who survive from medical treatment and rehabilitation, those who survive undergo prolonged suffering and incur lots of expenditure from medical treatment and rehabilitation. The high numbers of road traffic crashes has led to a strain in the healthcare systems in the country. The estimated annual healthcare cost attributable to the road traffic injuries is 46.1 billion shillings. In response to the epidemic of road traffic injuries, the Ministry of Health has equipped public hospitals with necessary diagnostic technologies and drugs to take care of the victims of road traffic injuries. In the areas of pre-hospital care, the ministry launched the emergency care policy in 2021 that aims at establishing a vibrant emergency medical care system as a key enabler to achieving universal health coverage. This policy is in line with the fifth pillar of the decade of action for road safety, strengthening of post-crash care. The Emergency, Chronic, and Critical Care Fund will offer financial protection from victims of road traffic crashes in the emergency settings. Plans are underway to implement a trauma registry that will provide an accurate account of the injuries resulting from road crashes. The ministry is continuously training healthcare workers on trauma care, and we are particularly keen to ensure that their training involves the adoption of modern technologies. The community has also not been left behind either, as we conducted training targeting the community on pre-hospital care. All this is in a bid to ensure that the seventh strategic priority of the National Road Safety Action Plan, post-crash care, is implemented effectively, with the health sector taking a leading role. Ladies and gentlemen, road safety prevention strategies are well known. The report gives a detailed account of the regions and countries' status regarding these strategies and interventions. The process of data collection itself provides an opportunity to strengthen multi-sectoral action within countries, as different sectors are required to come together and reach consensus. As I conclude, I reiterate that the Ministry of Health will continue collaborating with the partners to improve road safety in the country. The public health sector will continue to strengthen emergency services for victims, improve data collection, contribute to the policy development, and participate in the development and implementation of prevention activities. This is further reinforced by the fact that the Ministry of Health has included the reduction of the burden of road traffic injuries as one of its strategic objectives in the Health Policy 2014-2030. I wish to offer my sincere appreciation on behalf of the Ministry of Health to the organizers of this event. It is my hope that this launch will spur renewed vigor and improve road safety in the African region. Thank you, and God bless you all.
Thank you, sir. Thank you very much as well, and our regards to entire leadership at MOH. A round of applause, please, to the Ministry of Health and for that dedication. Ladies and gentlemen, I'd like to move the attention to this side of the room, if you can see where I'm at. If you can all please get a vantage view of this end, because shortly we'll be unveiling the report. I know on your tables we have some just bit of highlights, and you've had some of the numbers, the figures that have been mentioned. Something that stood out for me is what the DG said, comparing fatalities to injuries, looking at how do we call for more partnerships and collaborations, seeing areas of synergies, other aspects from MOH that we can pick up from NTSC as well from this report. So I want to just reiterate our hack we're running is Africa Road Safety. Thank you for those of us who have engaged with us online, and also to our online audience. Africa Road Safety is a hashtag we're running. I'd like to give a shout out to the Science Africa team. Thank you. I see a team of journalists who are here covering this as well. on your mobile phones. Quite interesting and revolutionary. At this point in time, allow me to call on this side, Madam Bright. If you could just please join me on this side. DG NTSA, so please welcome back. Our Director General, if I can have, as well as the Dr. Abdurrahmane Diallo, who's the World Health Organization representative, to please join me. Dr. Isaac Bashir, Director of Family Health, to please come up. Madam Kiara Rettes, coming here for the first time, but of course she'll be moderating the panel with all these dignitaries, and you'll hear more from her as well. Fair enough. Yep, just getting a bit of foot hops. I hope my colleagues, the media, can get this if you all have a vantage view. Very well. So I'm going to ask Dr. Abdurrahmane Diallo to come on this side. Maybe you can just do a quick over. I now would want. Great behind the scenes conversation there. Ladies and gentlemen, for us, we're going to give a countdown. There'll be a countdown clock on now, which will mark the official unveil of the Africa Road Safety Report as well by the World Health Organization Africa team. So are you ready? Are you ready? I didn't hear you. Are you ready? All right, ladies and gentlemen, please, all eyes on screen as we give a countdown to the official unveil of our road safety report. In 9, let's start. Eight, 7, 6, 5, 4, 3, 1, and action. Ladies and gentlemen, please give a round of applause, another round of applause, please, to the official unveil of the status report on road safety in the World Health Organization Africa region. Thank you so much, WR, for that. Let's please appreciate team as well, and the team right here on stage for the unveil. And shortly we'll be getting copies of that availed to you on your tables. I'm going to just take a quick photo of the team. Okay, if you could kindly pause for the photos. Okay, I'll just follow the direction of my colleagues. Okay, thank you, Oliver. All right. You good? Thank you. Thank you very much, ladies and gentlemen. If we could just settle back for a short engagement, and after which then I will come back up. You'll agree with me, as the report is being distributed, you all cannot wait to see what is being unveiled. But a lady who's quite critical, front and center in this is Madam Binta Sako, who's the technical officer at the World Health Organization's Africa Regional Office. That's AFRO. She specializes in violence and injury prevention within the Violence, Injuries and Disabilities Unit. She has over 20 years of experience in the health sector. Binta has collaborated with the private sector, non-governmental organizations, and academia in the prevention of non-communicable diseases. Binta has also a background in pharmacy and health administration and holds a Masters of Public Health from the London School of Hygiene and Tropical Medicine. So Binta's work is simple, looking at the key findings from the Africa Regional Report on road safety. It's my absolute pleasure to invite her on stage. Karibu Sana. Let's give her a round of applause, please. As we engage with her, please take a vantage view of the screen where I'll just give you a snippet on what's in that booklet.
Thank you very much. Dear esteemed guests, colleagues, partners, it is my great pleasure to be in front of you today to present the findings of the Africa Report. Can I have the next slide? I hope you can hear me well. In slide mode. Yes, thank you. Next slide, please. So some of you have already alluded to some of the findings of this report. This has been a very long process to produce, so I'm extremely happy to share the findings with you today. And I'd like to just give a shout out to all the colleagues that have been working with me in the last few years under the leadership of Chiara Retis here as well. It's been a teamwork and we're delighted to show you the findings of our work. So the WHO produces these periodic reports on road safety, and this is the 5th iteration of such a series. The global report was launched in 2023 in December, and we are producing the Africa Regional Report that we're presenting to you today. This report provides an overview of the situation of the African region, and we have 45 countries out of 47 that have participated. This will be the largest participation out of all the different status reports that we've produced. And it comes at a very opportune time because it closes the first decade of action for road safety, while it also gives a baseline for the new decade of action. It was a collaborative effort from member states, had many of their divisions involved in the process of data collection. And we had over 300 different contributors and national data focal persons who worked on this project with us. And I know the representative from Kenya is here in the room, so a big shout out to her as well. Next, please. You've heard it, you've seen it on the banners, that we have almost 250,000 deaths from road traffic crashes in the African region. That represents the highest rate in the world at 19.4. Next slide, please. And I think it was already mentioned, this shows the disproportionate burden that the African region has in terms of fatalities for road traffic crashes. We represent 19% of the deaths globally, but we're only 15% of the population, 3% of the vehicle fleet, and 1% of the network of paved roads. So these statistics really show how much Africa is disproportionately burdened by the crisis of road crashes. And those who are most affected are the vulnerable road users, who represent about half of all the fatalities, and in particular pedestrians, because if we look at the graphs here, we see that pedestrians are 1/3 of the mortality that we register. And this is the case in many countries. It's even a higher number of pedestrians that are affected. We cannot overlook also the four-wheelers, who do represent 32%. So they're also 1/3 of those affected. And around the world, we also have a number that's higher than the global average of four-wheelers who are affected. Men in their most productive years of life fall victim, and it's been, I think Bright said it very well, the effect on families and communities that come with that demographic being affected by this scourge. Next slide, please. We said that this report was also to show the progress since 2010. And what we see is that since 2010, we are unfortunately the only region globally that has increased the number of deaths by 17%. In all the other regions, there has been either a significant reduction, as in the European region, or stagnant and not much. So globally, we see that there's an average of 5% reduction in road traffic fatalities. Looking at road user type, the people who are dying on the streets, we see that in terms of progress, the power two-wheelers are really the most affected, because their numbers have doubled, whereas all the other types of road users has reduced. They have doubled. So this is really worrying, and I think anybody who lives in a big African city knows that this is a true problem. Next slide, please. Although the portrait that we may have been painting is dark, there is hope, because we see that in the last 10 years, there's also been progress, positive progress made by countries in our region. And we register 17 countries that have managed to reduce the number of deaths in their country. None of them has reached the 50% reduction as the target for 2020. However, they've made substantial decreases in the number of deaths. And I'd like to cite Seychelles, Mauritania, Congo, Cameroon, and Burundi that have reduced by more than 30%, up to 49%. Unfortunately, we did not go beyond the 50%. Next slide, please. We talked about multimodal transport, and especially the fact that most pedestrians are victim of road traffic crashes. Unfortunately, when we look at the policies around transport, we still have a long way to go in terms of walking, cycling, and also the use of public transport. As you can see these numbers, very few countries still have policies in place or track even the use of these alternative modes of transport that could be a solution to reduce the burden. Next slide, please. We also looked in the report at the different behaviors, what we call the behavioral risk factors, which are the speed, use of seat belts, or child restraints, helmet use, or drink driving. We looked at all these behavioral risk factors, and we see that for most countries, there's really uneven implementation and enforcement of what is recommended. So none of the countries actually meet best practice for all the 5 risk factors. And we have 29 that will have laws that will adhere to best practice in 1 of the risk factors, but then we have 16 countries who do not have any best practice law in any of the 5 risk factors. And since the last report, we have had a little bit of progress, but it's been 1 to 3 countries that have improved in these statistics, which shows that in terms of legislation, we really have a long way to go. Next slide, please. In terms of post-crash care as well, we see that it's low and inadequate in terms of infrastructure, but also in terms of providers. Very few countries have these assessments of their post-crash response, and which is usually the first step to set up a proper response. And 5 countries have national laws requiring some training of health providers or lay providers to provide the support. In terms of, we looked at emergency numbers as well. The recommendation is to have a single number with a national coverage, and we only have 12 countries that are within that recommendation. So overall, we can say that post-crash care and post-crash response is rather low. And next slide, please. We also see that the coverage is very uneven, where we see much more services in the urban area, rather than the rural area. So for the countries who reported, 26 countries reported that minimal to no rural emergency services were available. So this divide, geographical inequalities, is really something that should be tackled. Next slide, please. We also looked at the road infrastructure. I think it was mentioned, where we know that most of our countries don't have the recommended 3+ star rating. And when it comes to the vulnerable road users, we see that the quality of the roads is even lower. Next slide, please. Registered vehicles, they have increased. We see that the number of 2 3-wheelers has tripled. In terms of the light vehicles, it's doubled. But here we really wanted to mark the fact that 2 3-wheelers has dramatically increased in our region, knowing also that that deaths have also doubled. I think it's something that we'd like our authorities to really tackle and look at seriously. The number of vehicles are increasing, but we have a greater share of imported and usually substandard vehicles in our countries as well. And in terms of legislation for standards, we are really very low. You see the ones for pedestrian provisions in standards are inexistent. Next slide, please. Data management is one of the main challenges. We've had, I think, great progress since the first status report. We see that in terms of discrepancy between the estimated and the reported data, we have reduced those discrepancies by almost half. But there remains huge challenges in terms of completeness of the data, and also capturing data that's needed to make efficient decisions in a timely manner. So this is an area that really needs to be looked at very carefully to improve our systems. So I'd like to finish here with the key recommendations from this report, which is to say that we see that the target is reachable. We have another less than 10 years now to reach the end of the decade in 2030. And we see that many countries throughout the world, and even in Africa, have almost reached, and by concerted effort, we're sure that we can make it to the 50% reduction in the next few years. We do need concerted and coordinated efforts. We need to work together. I know, Bright, you mentioned working together and having all the different partners together on this. There's need to strengthen legislation and also adequate enforcement. Enforcement has been very difficult to measure in this report, so we only have proxies, but we usually know that enforcement has been very low and needs to be enhanced. We need to implement what we know works. We have the safe systems approach. We've had great it's worked elsewhere and it should work here as well. Of course, adapting to our local context and supporting data systems. As this last slide I was mentioning, there's really a need to ramp up our data system to make sure that we do make the right decision in a timely manner. And looking into the future, I think it's important to think about the vulnerable road users, the pedestrian, the cyclists, and promote the safety of those modes of transport, not only for the benefit of health, but going beyond health, for a healthier environment as well. So I'd stop here, and I'd like to thank you very much. Karibuni, I hope I'm saying it right. Thank you very much.
Thank you, Binti, as well. Please give a round of applause. And the entire World Health Organization team. I know we have the Kenya office, the Africa office, and I'll leave that to Kiara to do the recognition when she comes up. But before I do that, I just want to transition for really quick as we set up the stage. So at this point in time, I just want to open up the audience. I know we have many partners, different teams as well that are represented here. Please get to know who's on your left and right. If you haven't, I hope the Science Africa team is not sitting all together, your different sides, just as we transition into our panel. I hope that we'll also get to hear from the different champions who are in the audience. We'll have a short Q&A session as we go along. I also would want to see how we can involve the online audience as well for the question and answer session with our various partners as well. So in just a minute or two, please just get to know who's on your left and right. I'll be passing the mic around for an introduction. And you'll be introducing your neighbors. So please just get to know their name, what they do, and where they work. Maybe that will help. Over to you. Sure. So do you know the person on your left and right? Right? Yep. You've got enough fair understanding of what they do and how they'll help in the road safety efforts. Legislation, looking at how do we look at safety systems approach, supporting data systems, how do we advance greener and safe transport systems? Those are some of the key questions we'll be seeking to answer in this panel discussion. Without further ado, ladies and gentlemen, allow me to introduce to you Madam Dr. Kiara Reches, who's a team lead at the Violence, Injuries and Disabilities Unit at Healthy Populations Cluster. That's at the World Health Organization Regional Office for the Africa region. She's a public health expert who has earned a master's degree from the London School of Hygiene and Tropical Medicine. She has over 20 years of experience in international development, working with government, non-governmental organizations in conflict-affected and low-resource settings just to provide capacity building services and supporting policy reform in the field of physical rehabilitation and, of course, assistive technologies and disability inclusion. She's experienced in disaster preparedness and response, rehabilitation services, management, and quality improvement. And she's also worked as rehabilitation specialist in support of the humanity and inclusion teams and partners in Middle East, South Asia, and Southeast Asia. Dr. Kiara, I know you have a lot on your plate. First, to moderate the panel, and at the same time recognize your team as well. I see Jemima, Greg, and the entire team as well from the larger World Health Organization. Ladies and gentlemen, it's my absolute pleasure now to invite her on stage. Please give her a round of applause as Dr. Kiara takes it up from here, where she'll be moderating the panel, and then I'll come back for the Q&A session. Over to you, madam.
Thank you. Good morning, everyone. It's really a great pleasure for me to be here today. And as our moderator just said, I'm really representing a big team. Many of them are sitting in this room and are here with us. Many others are in the regional office, but I would also like to acknowledge the contributions of all the member states who participated to this big exercise and the partners and organizations of the civil society that were also contributing to this report. So my role now is to facilitate a panel discussion. We will have a group of speakers who represent really, different dimensions of the work around road safety. And we would like to really give the opportunity to hear more about our host country, the Republic of Kenya, about good practices and challenges and their experience, but also to provide a regional perspective so that we can learn from both local and regional networking and advocacy. So I will proceed with inviting on stage our speakers. So please, Dr. Duncan Kibobo, come to stage. Duncan is the Deputy Director, Road Safety Strategy at the National Transport and Safety Authority in Kenya. Thank you. Also, Dr. Joyce Nato from the WHO Office of Kenya, Program Manager for NCD's program. Mr. Patrick Kinyanjui, representing the Africa for the Global Alliance of NGOs for Road Safety. Thank you. And Janine Tunis, please come to stage. Program Officer for the Sustainable Mobility Program at the UN Environmental Program, UNEP. And for the Ministry of Health of Kenya, Dr. Gladwell Gatecha, the head of the NCD division. Thank you very much. So I would like maybe to start from the experience of Kenya, Dr. Duncan. We heard a lot about regional challenges, some emerging common challenges of this region. But can you tell us more about the priorities for this country, for Kenya? So what are the local priorities, and also what are the plans and the strategies that you have already started to implement? There are excellent initiatives, excellent practices, no, that you will be able to share. So we listen to you. Thank you.
Thank you so much, Chiara, and welcome to Kenya and everyone else, all the audience who are here and those who are online. Thank you so much. As you've been told, I work with the National Transport and Safety Authority. That is the lead agency in Kenya on matters road safety. Our work really is to coordinate matters road safety because, as you all know, that road safety is a shared responsibility. You did talk about what our plans on matters road safety in Kenya. And as my Director General had mentioned earlier during his remarks, is that Kenya did launch the National Road Safety Action Plan in April. And the launch of the National Road Safety Action Plan was a step forward in driving matters road safety agenda in the Republic of Kenya. And this particular action plan actually was launched at the highest level possible in government by His Excellency the President of the Republic of Kenya, Dr. William Ruto. And I know most of us who are in this team, who are in this room, did actually attend. And that action plan was done or designed from what you call a multi-sectoral, multi-agency point of view, meaning that it was not just from a government point of view, but took the interests of all other stakeholders. Out of that came the National Road Safety Action Plan, which defines the road safety agenda of the Republic of Kenya for the next 4 years. That is from this particular year, 2024 to 2028. The target of reduction of fatalities by 50%. And that action plan, of course, is premised, and thanks to WHO and other partners, premised on the best practice, the principle of road safety approach, the 5 pillars. And it has 8 priorities, right from the issue with the coordination and partnership, issues with financing and funding of road safety, as aspects with data, issues with enforcement, legislation-related issues, public education, and a range of others, including infrastructural improvement, which was mentioned as an important part of it. So we do have those plans, and remember that we'll be working from a multi-sectoral point of view. What that means is that each of the agencies within government, even those without government, are going to play a role, and all that will be monitored, and we'll plan together, monitor together, implement it together, and then we see if there's any corrective action. So it's a 5-year plan, very well structured, and we'll probably be sharing with the team here our National Road Safety Action Plan, which is even in our website, so that we all see what you're doing. So that is the plan for Kenya. Of course, with challenges, some of the biggest challenges being financing. Finances, funding for road safety is always not enough. We're still working on our data systems, you may have seen, but this particular report also indeed has come at the right time because it forms a baseline for implementation of our action plan so that we know where we are as we're going forward. But we do, of course, but we are working on our capacities. The government is indeed very serious on the same, and that is pointed out by the fact that the President himself of the Republic of Kenya did participate and actually did give us some indications of what needs to be done the next time, in the next 1 year, when we review our progress. So, Chiara, that is in brief my response to that. Thank you.
Thank you so much, and thank you for highlighting how comprehensive this strategy needs to be, and the need to work with others, to really have an impact and be effective, and also highlighting the importance of data. We know that requires a lot of work, a lot of efforts and coordination, but it's essential to understand from where we start from and to measure the progress. So thank you very much. Always talking about Kenya, maybe Dr. Gladwell, you can tell us a bit more about the role of the health sector in addressing mortality and injuries, because we heard that this is not at all something to be neglected. On the contrary, the burden of injuries on society is great. We heard already many details from Dr. Bashir during his remarks. Can you tell us a little bit more about maybe the best, the good practices, some successful actions that you are taking and your considerations around this? Thank you.
Okay, thank you, Chiara. So the health sector is known for dealing with the after effects of the crashes, taking care of the injuries. But as we all know, health is not just the absence of disease. So we can't just wait for the crashes to happen. So we do have at the foremost a role in the prevention, because as we all say that road traffic injuries should be managed using a public health approach lenses, meaning that there are preventive aspects that lie with the Ministry of Health. So there is the first issue of health promotion or education, and where the health sector comes in is trying to portray the consequences or of the injuries, both in terms of mortalities, disabilities, and even the normal injuries. And this linking them and saying it from a health lens is at least puts more prominence to the prevention aspects. Also providing evidence in terms of like for the wearing of helmets, linking it to the consequences of the head injuries, and then now meaning that after that, life now does not become as usual. So there is that aspect of providing data. There is that aspect of health promotion. And the data we provide has to be used together with that from the police records. And we do follow the patient across the whole spectrum. That's why Dr. Bashir earlier on talked about the introduction of a trauma registry. This will help to delineate the injuries more specific, such that it can be even more useful in terms of policy and action, in terms of what are the things that should be done immediately at the scene of a crash and what have you. So the health sector also has another role when it comes to prevention of ensuring that the drivers we have on the road are fit to drive. So that's that is something that is domiciled in the Traffic Acts. So we prescribe what should be, let me, for lack of a better word, what are the qualifications for someone to be called a fit driver. This is still a work in progress. We have developed guidelines that should, at a starting point, be used for PSV and commercial drivers, and then next on rolled to the whole public. But these are still in draft form. There's also the area of research, as I mentioned, just going into the whole systems approach. What are also some of the human factors, like the mental aspects that contribute to good road use habits. And then when it comes to now the issue of taking care of the victims, that's when now the health sector plays the biggest role. And we look at the aspects from the scene of the crash all the way to rehabilitation. Dr. Bashir did mention that we do have an emergency care policy, and this is where we are trying to coordinate all the players in the emergency setting so that we have a coordinated approach. We're also trying to mop up more funding for this area, such that, and it is also enshrined in our constitution that every Kenyan has the right to emergency care. So this is something that we should be able to define at least what an emergency is, which victims of road traffic crashes will fall up to, and usually up to the first 24 hours. So we should be able to provide this emergency care, meaning that also when they are transported to their health facilities, then that's where we say that our healthcare workers should also have the right equipment, have the right skill, there should be the right medications. And we are, to ensure that all this is happening, we do have trainings that we are continually giving our healthcare workers. We are also having our essential medicine list, ensure that the drugs that are mandated to be having in different levels of hospitals are also available and at all times. And then the right equipment are there to either diagnose an injury or to also follow up the patient as they go on with the treatment. So those are some of the things we are doing as a health sector to ensure that the safer systems approach for road safety is being used. Thank you.
Thank you. You have really highlighted several essential components of work. So not only, related to the health services, delivering health services and rehabilitation, as you mentioned, and emergency care, but also all the work around the determinants of health, changing behavior, and the prevention aspect. So there's and data again, how the health sector can contribute with data collection. So thank you so much for highlighting this big scope of work of the health sector on road safety. If we move now to, I would like to ask Mr. Patrick to tell us a bit more about what the Global Alliance does globally and regionally for road safety, and in particular, how the findings of this report you think will inform the strategies, the approaches. We are now not talking more about advocacy, but not only community engagement, how to engage with communities and the stakeholders. Thank you.
Well, thank you very much, Chiara. Thank you for the invitation and for recognizing the civil society movement. So I'll start by saying my name is Patrick Kinyanjui. I'm based in Nairobi, Kenya, but I work for the Global Alliance of NGOs for Road Safety, and I'm the regional coordinator for Africa. The civil society and non-government organizations are very key in terms of improving the road safety situation in Africa and in individual countries. Now, we know from the perspective of the civil society, one thing that should be clear is that the communities or the people demand safety from the government. The government has the responsibility to keep people safe. Now, how does the civil society come in? In the older or traditional thinking, the civil society would be very critical of government, making noise to the government, which is okay, because the civil society is the voice of the people. But moving closer now to what it means by partnership collaboration is that gradually we are trying to support government in its efforts to make roads safe. So the core mandate of the civil society and non-government organizations is advocacy. We may not be implement physically, like make roads better by constructing, but we can actually point the government to the right direction. So in advocacy, what we are doing, and coming to your question on what is really these findings mean for the non-government organizations, is that we are being able to make very strategic plans for advocacy that are based not only on knowing that we need government to implement, one, evidence-based interventions. Secondly, that we need government to increase funding and be transparent in funding road safety. And thirdly, to always involve the civil society and non-government organizations in decision-making processes. And this is because, as Chiara, you're saying, the NGOs know they are in contact with the communities. They know what is happening at the community level on the ground. So they are able to feed government on the actual challenges and problems that communities are getting, and they are able to actually inform policy decisions at the highest level. So based on that kind of synergy, the involvement of non-government organizations in decision-making process is very important. So that space, we really need to increasingly allow the civil society to be there in decision-making process. So we are doing better in the findings here are not only a baseline, as it has been said, a baseline that will help us not monitor progress that the government is doing, but also be able to measure progress as we move, and we know when to maybe fast track some of the interventions that are being done. But most importantly is implementing also the laws and legislations that are already in place, because I think when you look across, when we assess legislation across Africa, you find countries actually have many laws. Policies have been there, but most of the time you find they are not implemented. They could be on the shelves, so to speak. But we have found the problem with this is, again, lack of incremental budget allocation to road safety. Road safety being relegated as the last, among the last priorities of government, yet it is important. It is actually a number killer in the first 10 social killer effects. So what we are looking for is on the side of government, very important, because we are supporting government, but we are also holding up the government accountable. So we are working on a strategy called accountability, sort of checking the government accountability using a very, very clear pathway that will help government also improve. So that's a response to that question.
Yeah, thank you. Thank you so much, Patrick. Importance of the participation of the users, of the road users, but I would say of the communities in general who live, no, in the urban or rural environments, and the importance of making government authorities accountable, the issue of implementing no, strategies or policies that are there. We know that it's challenging and it requires really joint efforts and monitoring. So thank you very much for your contribution. And Dr. Joyce, I will take the opportunity to ask you a question about the role of the WHO as an organization that assists, facilitate, no, the coordination of several actors working with authorities and partners. Can you tell us a bit more about the guiding principles, the approaches to help reach the SDGs goals and the targets for road safety?
Okay, thank you very much and good morning, everyone. As you've been told, I'm Joyce Nato from WHO Kenya Country Office. What is the role of WHO in this area? When I'm asked that question, I start thinking about somebody who is living downstream, and every morning you are going to fetch water or something like that, and you fish out a body. You go the following day, you fish out another body. The following day, so will you continue going there to fish the bodies, or will you sit down and think, what do we do? So the role of WHO is to go upstream and see what is happening. Why are these bodies coming down? And then we sit down, we look for all the stakeholders involved, coordinate them, and see how this issue can be stopped. So the role of WHO is coordination for the stakeholders. Number two, we support the government to prioritize this area of work. We know countries like Kenya, communicable conditions are very high. And if we don't point out to the government that we also have non-communicable conditions, you find that all the efforts will go to communicable because they are really still rampant. So we point out to the government and say, please, can you prioritize this area? For example, in I think it was 2011 when we had the first the road safety global action, and we had to point out to the government, please look at this. Where are we with road safety and so on? And through that, we support the government to come up with policies, strategies, action plans to prioritize this area of work. After the documents are in place, we also support the implementation aspect. We have been told about data in the countries. It's a big issue in this part of the program. And you find that, I think it was mentioned, harmonizing the data from police and data from Ministry of Health. We have tried to support the government to harmonize these two data, to look at it and see, because always, for example, there is a crash, 2 people die, and 10 are rushed to hospital. Police may not follow up on the ones that have been rushed to hospital. The hospital have received 10, and then they say out of 10, 1 died. So which one? Which data are we looking at? Are they 3, are they 2, or are they how many? And maybe somebody may die after a month. How do we look at it and say it was because of that crash of that particular time? So trying to help the government to come up with a harmonized data. We've heard of data registry, the trauma registry. We are also supporting that to see to it that we have correct data, and with the data we can use it to improve on policy and on implementation. So in a nutshell, WHO is a technical agency providing technical support to the country to implement the impact of road crashes and to prevent. Prevention, as we know, is more important. We've heard from Bright, 27 years, still paying for it. Is it an easy thing? Please, let's prevent before we start doing the controlling and so on. Thank you.
Thank you, Joyce. I will just pick one thing among the many interesting things that you said. You talk about the importance of prioritizing. We do have data that show us, that give us the rationale and the justification to prioritize some actions. And this is needed when we all know very well that resources are limited. So that it's an essential guidance that is given to authorities and partners, to help really prioritize based on the needs of the country. Now, to conclude our very interesting exchange, Janine, let's touch on something that came out very clearly from the report, which is the vulnerable road users are the most affected. Africa has unfortunately shows that the highest proportion of victims among pedestrians. So what can you share your highlights around what are the challenges at the regional level, but also what are the opportunities today to think differently, right, and move forward? You have 1 minute.
Okay, good morning. For those who may not be familiar, my name is Janine Tunis and I work in the Share the Road program at the United Nations Environment Program, where we focus on delivering policy and infrastructure and support to governments for the walking and cycling agenda. Now, I don't want to dwell too much on the challenges because I think all of the speakers here and all of those who are holding the report in their hands are well informed of what the challenges are, but I will say it in just one sentence. African cities are walking cities, but they are not walkable cities. The experience of people moving by foot or by bicycle in many of these cities is truly a hardship, not only because they don't have the supporting infrastructure for a continuous journey from start to finish, but also because many of them are walking for a considerably long period of time. We did a large piece of research last year on trying to understand what the walking and cycling environment looks like after being met with multiple responses from partners that there just wasn't sufficient data to really know where to start and how to take action. And I think really all of that information on the quality of roads, which Binta emphasized in her presentation as well, the time spent active for transport, which is another scope of work under the WHO umbrella, the experience of people walking and cycling, where it feels good, where it doesn't. Truly, their experience is their expertise. And in applying the safe systems approach, which I can see has been a golden thread throughout all of those interventions today, starting from the very first opening speech from Bright, not just seeing them as individual pillars, but really relating them to that human experience at every moment, putting people right at the center of all of those things that we are taking action on. And that's a really robust and proper way to address these issues which impact and affect their lives on multiple scales. I think that there is a lot of opportunity, a lot of collaboration across agencies, and a lot of growing dialogue around the multiple impacts of action for road safety, particularly for pedestrians and cyclists, not just for saving lives and improving well-being for communities, but ensuring that future that we all want, one that's more sustainable, one that's greener, one that's fresher, one in which we can move in between places without being concerned about how safe it is to get there or not. To conclude, I will just say that I think it's an exciting moment. Of course, we need to stop and reflect and look at the seriousness of the situation and be serious in addressing it. But there are solutions that exist within the continent, some good low-cost interventions that test how people's experiences relate to those different things, and then you can determine which ones are worthy of the high-impact investments. We have it in programs for safe routes to school. We have it in car-free zones. We have it in car-free days. Lots of activities and actions spanning from Kigali all the way to Morocco to South Africa. A lot of good practice and a lot of sensitization to that experience. Really just, I find it quite inspiring, and I'm glad that we're here to share all of these experiences together. And I look forward to learning more and really being serious about this serious topic, but in a way that's proactive and feels good and values people's experiences.
Thank you, Janine. I think your words very nicely conclude this panel discussion, highlighting the importance of people first, putting people first. Yes, we do need to work on vehicles, infrastructure, and data, but we do need to think from the point of view of people, how they move, how they live. And there are good practices. So looking forward, we really need to look at what works, how to adapt it, and scale it to accelerate the progress for Africa, because there are plenty of opportunities. So I will give the moderator the next stage.
Sure. Please give a round of applause, ladies and gentlemen, to Kiara and the rest of the panelists. We'll just ask them to be a bit patient, really quick, just so that we can field any questions, comments from the audience. You can engage with us. Any media questions, this is a chance. So in just a few minutes, and then we'll close the panel. Moving over to the back, let me just raise your hand and I can see where you're at, and then I can come to you. So I see one hand here, yes. Just want to see sample. All right, let's start from you, madam. Please stand, introduce yourself, who your question or comment is directed to.
Good morning, my name is Emily Chebet from Citizen TV Kenya. And first of all, let me just appreciate the organization that brought together this, because I think it's a very important conversation that we are having. But just a quick question, coming from Kenya, I think I'll direct my question to Dr. Kibogong. Do we have a budget for the National Transport Safety Authority? And maybe what are the measures currently that you're taking in terms of looking at those vehicles that are worn out, they're not roadworthy? And also maybe to the United Nations representative, what is the role of your organization, the UN, particularly in Kenya, or after doing that report that you said you had a report last year? What are the action plans when it comes? Because definitely people would love to cycle, walk, but the places are not very good. So after the report, what next? Thank you.
Thank you, Emily. That's to Emily as well, and to Madam Jen. Allow me, sir, to just give you a chance to speak. Our superintendent, you can just say something, I think, on behalf of the larger enforcers.
Thank you, the MC. My name is Superintendent Boniface Otieno. I work at the Kenya Police Service, Traffic Department. But looking around and the discussions we are discussing today about road traffic crashes, I think the law enforcement officers may be assumed to be the gateway of the data we are talking about. In Kenya, Traffic Police Department are the first responders to all road crashes. So the challenge or the observation we will give is, to what extent do we engage law enforcement officers, particularly dealing directly with the traffic? That's why you can observe there is no police officer there. On a lighter note, but the role of law enforcement officer in road safety is very key, and I'll encourage the meeting to always consider that. because the data we have, they give it. The representative of World Health Organization in Kenya has rightly said, sometimes the body we pick at the accident scene are 3. We take survivors to the hospital. Some might lose their lives at the hospital. Do we have mechanisms on how police will get that record from the hospital? And in Kenya, the director of NTSA is here, we are really working on that so that we harmonize our data, so that a reported case will be followed from the police station to the Ministry of Health, to the register of deaths, so that we account for this accident. So in Kenya, we are really working on that. But the role of the law enforcers in road safety is very key. Wherever they are, I'll advocate for them. And next time, I would like to see them more from the countries represented here, that we have traffic departments in the meeting. Thank you.
Thank you, sir. Superintendent Boniface Otieno from the Nairobi Traffic Police. Take that as a comment.
Good morning. My name is John Muchangi from Star Newspaper, and my question is to Gladwell Gadesha. I think you mentioned in passing about the draft, I think it should be draft regulations to determine who is a fit driver. But I think I really wish you could expound on how far we are, what we expect. And then I have a question for Dr. Isaac Bashir. I hope he's still around. Yeah. Also, you mentioned about the trauma registry. I think when I checked, we lastly had 3 hospitals that established trauma registries in Kenya. Maybe what is so far, what progress have we made to have a better program for a national-wide program on a trauma registry, so that we can know the kind of injuries we get and what kind of injuries are they, and what the causes of these injuries. Thank you.
Thank you, Ms. Shange. Moving over.
I'm Masi Kachenge from Medical Media. So we remember the accidents of Kenyatta University students where we lost over 11 students on Kiamba Road area along Mombasa Road. So the issue was the issue of trailers interacting with small public vehicles along the highways. So my question is, what can be done to address the issue of trailers interaction with public vehicles and small vehicles along major highways and on our major roads?
I know we'll restrict it to the report. Leave that moderated close. So I'm down from the back, ladies and gentlemen. Take the last 2.
Thank you so much. My name is Agnes Kyota, multimedia journalist from New Vision, Uganda. So my question goes back to the report. Yes, 17 countries have reduced the number of fatalities. I would love to know which ones are those for best practices. Thank you.
Thank you very much. My name is Abtamu from Addis, covering the African Union, a journalist there. So my focus is more on the lack of policy commitments on a wider continental level and what should be done to address this lack of policy commitment. For instance, the African Union adopted the African Road Safety Charter back in 2016, but unfortunately, as of yet, it's still yet to get the minimum threshold of 15 ratifications to get into effect. So, but in the meantime, there were many other policy frameworks that were very, positively able to proceed into effect. So what should be done, including Kenya? Kenya is yet to be even to ratify or sign on that framework. So what should be done to improve this?
Lastly.
Hello, my name is Tiffany Mwakisha, and I think I want to expand on the question from the police representative and introduce that of corruption. Corruption is a major driving force in how road enforcement and safety works. The police are the people who stop everyone, the drunk drivers, the people with invalid licenses, all of that. They are very corrupt in Kenya, as is known. Even the NTSA, who are known, or rather, who hand out licenses and determine who's a fit driver, has also dealt with a lot of corruption internally. And so I'm wondering how data should be collected to deal and incorporate that corruption, and also why hasn't corruption been mentioned in the report, and how can it be mentioned and incorporated more?
Thank you very much. I was just conferring with the moderator on the time we have left. Ladies and gentlemen, we'll be done by 11 precise. So please give a round of applause to all the questions and comments. I'll throw it to Dr. Kiara to just maybe do a quick fire response. And of course, just to mention, we'll also have some session for media interviews just right after we close.
Thank you. There were very specific questions around specific issues or areas of work in Kenya. Maybe Dr. Duncan, you can quickly provide a feedback around that.
Thank you so much. I think I had a number of questions, some general, some specific. Madam Chebet, you asked something to do with, what was it, if you remind me? Yes? Yes, yeah, correct, yes. You did mention that whether we have a budget as NTSA to implement the National Road Safety Action Plan or something. Yes, of course, we do have a budget. As a government agency, we get some budget from government. We also have internally. But I think the main point which I need to put forth, probably I'll start it from this point of view, that road safety, as we speak, and the way we envisage even in this particular room, is not one agency affair. It belongs to virtually everyone, and I think that has been drummed all along. That's number one. Number two is that if you estimate the cost of road traffic crashes in Kenya, it amounts to about 4 to 5% of GDP, and that translates to about over 500 billion Kenya shillings. About if I just quick, it's about 5 million USD, 5 billion USD. That's quite a huge number, and I think we need to invest more. Resources are not adequate. Problem number three, I need to say in this very quick fire, as Kiara said, is that we envisage implementation of National Road Safety Action Plan from different stakeholders. For example, one of the things which I think when we share the report with yourself as well, is that we identified what does the road agency do. For example, KENA, that is Kenya National Highway Authority. So there is identifiable actions which they need to do, and that financing will be drawn from them over the period of the implementation. What the National Police is going to do is so each of the agencies is going to implement as per their mandate. The role of NTSA will be doing that aspect to do the supporting, the coordination, doing the monitoring and evaluation, and then subsequently. So basically, it is not that all the monies will be lumped together to one agency, but will be implemented separately, but in a manner where each of us is accountable as government agencies as well. But not notwithstanding, I think the resources from the look of the things is that with the political support, high-level government participation in matters of road safety, that should be something which you're going to achieve with development partners here and outside here. We're going to support us, and you're going to do that. Then in quick succession, Ken, I think you mentioned something just that for the sake, I know you directed the question to Dr. Gladwell on the medical assessment. We do have the laws around the same. Traffic Act mentions about medical assessment of drivers, and it mentions that, and we even have a regulation under the driving school rules, which talks about medical assessment of drivers to assess their fitness to drive. And I think that's quite clear, and we can talk about that. You did mention from African Union that you report African Union from Addis. You are right that in Africa, and I think that came out even in the report, that the adoption of relevant policies at different levels, either in African Union or in regional institutions like East African Community, COMESA, and all that other agencies, is something which is very critical. To answer your question, yes, Kenya have not ratified and adopted to the African Road Safety Charter. That's an area, a work in progress, working with the relevant agencies. There's a whole process in the Kenyan system of how that happens, because it needs to go to the ministry, it goes to the cabinet, goes to parliament, goes to public participation, and then subsequently it's going to adopt it. But I know that we are trying to work towards having 15 countries in Africa to begin with, so that we implement the African Road Safety Observatory amongst others. And with the permission of the Director General here, who is with me, my boss, is that we work towards undertaking to become one African country who will be working towards ratification of that charter. And as a matter of fact, if you check our National Road Safety Action Plan, we even put some timeline in on how we need to move towards having the African Road Safety Charter, amongst others, whereby Binta from Afro office mentioned about the issues to do with the UN Road Safety Conventions. There are 7 or 8 or so which are important to road safety. Is that we've already have one in place, and we're working to have others, amongst other tripartite for COMESA, for this region where we are, amongst many others. So I think that is what you mentioned. On what you mentioned, Makisha, quickly, I think because of lack of time, is that yes, corruption is a challenge, not just in Kenya, but across Africa and even globally. I'll speak from my institution, is that we are doing a lot on that. In fact, we have a whole plan on that corruption mitigation and control, including automation of services, so that our services, largely speaking, and my director, I hope will give him a chance, will tell you how automated we want to work towards, including driver training, driver testing, issuance of licenses and all that, so that we remove that element. But that notwithstanding still, the human component is something which you work around. It is, and for the speakers, for people who probably do not know Kenya, and also the speaker, the listeners out there, people who are viewing this program online, is that as government, we have a whole agency, independent agency, who is working on matters corruption, the EACC, and we are empowered, they are empowered to work around that particular aspect. So in brief, that's what I would want to say. I may have skipped out something. If I did, you probably can remind me. Thank you.
It was Emily, right? Okay, great. Emily, you asked what is the UN doing since that report that we published previously? And I think maybe just important to clarify, there is the UN Environment Programme, UN Habitat, and WHO. We have different remits, but as you can see, we all get along because we recognize the multi-sectoral need to collaborate. But what we are doing in Kenya specifically is supporting local government in developing more robust infrastructure designs and policies, and creating that moment in which communities can connect with government to make decisions about what is needed. So we have some collaborations with Kura, UN Habitat, I know, is working quite closely on the Nairobi River Regeneration Initiative, and there are several other elements that I'm happy to share with you after this discussion. But I would say, in reference to the report that we published last year, this is the new reference point. If you find your hands on the one from then, make sure that you have this one with it and read it together in tandem.
Thank you. In the interest of time, I think we will now wrap up. I think all that has been said and the contributions from the audience are really meaningful and give really a comprehensive view of what are the issues and what can be the solutions. So I will use the opportunity of the question that came from the audience about the countries who did good. No, what were the practices? How was that possible? So there certainly was a great leadership in countries. It means that in the countries that managed to make progress on road safety, reducing fatalities, do have a strong leadership in country. That means the capacity to strategize, to allocate resources, but mostly to work with all the partners that are relevant, so to coordinate. They are able to also use data to show progress, of course, and the most important thing, they apply a safe system approach that has been mentioned. That means that there are many recommendations. There are so many recommendations and things that we know work based on evidence. We don't need to do them all at the same time, but countries who made progress definitely were able to implement at least one of those recommendations, looking at the system, either looking at safe users, or looking at safe roads, so improving infrastructures, looking at also multimodal transport system, meaning looking at how to combine the different modalities of transport, no, to make it more environmental friendly and people centered. No? This is another key concept. So those are the solutions or recommendations that exist. We do know that it's very challenging and it requires a lot of work and coordination, but considering the burden of issues no, related to road safety, this is imperative to take action and to work together. I think this great audience gave excellent examples around that. The stage cannot accommodate all the stakeholders that are needed. So health, transport, police, interior, thank you very much for your contribution. That's essential, of course, and many more. So with this, I would like to close this panel discussion, and thank you again, everyone, for your time and contributions.
Thank you, Dr. Chiara. Please stay on stage, dear panelists. Please stay on stage. I'm going to ask you to please stay on stage. Please give them a round of applause. I would like to appreciate you. And in view of time, I promise us to be done by 11 precise on the dot. At this point in time, it's my absolute pleasure to invite back up on stage Dr. Abdulrahmane Diallo, who's the WHO Kenya representative, to give a short closing remarks, and then we'll get to a bit of a quick photo ops with the panelists and other partners.
Thank you very much. No, mine is going to be short. It is actually to convey a word of thanks from the regional director of WHO Afro, my sister, Dr. Chidi Moeti, and from the director of the Healthier Population Cluster, my sister and daughter of Kenya, Dr. Adelaide Onyango. So on their behalf, I would like to sincerely thank all of you for making time to come to this important event. We all know that you have a very busy schedule, and we know the prevailing context, but despite all of that, you made time to come here, and your presence speaks for your dedication, your commitment to this important subject. And I would like also to thank the colleagues and partners who are online, because there is live streaming of this event. So I appreciate them as well for taking time to follow this important activity. And to the organizers of this event, fantastic job. I would like to recognize all of you and thank you, those who are visible and those who are behind the curtains, who worked very, very hard to make this happen and to make it a successful event. To the technical team that worked really, really hard to produce this fantastic report that we saw, Dr. Chiara, Binta Sako, and the entire team that you worked with, I would like to also thank you for your dedication, your commitment to improve this aspect of what we do on our continent. The partners involved, because we closely work with multiple partners, I'd like to recognize them as well, because nothing is done by one agency alone, as said here. So we work closely with multiple partners, not only in producing this report, but in what we do daily. So I'd like to acknowledge those as well and thank them. Member states, because what we do is actually to support member states. I always take every opportunity I have to say that WHO is a member state organization. Member states own the organization. The rest of us are just the secretariat. We implement what member states decide, and actually member states decide also how we operate. So I would like to recognize that, because none of this work would have been possible without the commitment of member states as well. The government of Kenya, our host, so thank you so much to the representatives of the government for hosting us, allowing this event to take place, and for your continued collaboration and support into everything that we do. So again, ladies and gentlemen, I don't mean to forget anyone. We heard Binta Sako share with us some of the key findings of this report. Obviously, I'm not going to go over it again, but I do believe that there are some key messages that we heard there that are important to reiterate, maybe focusing more towards finding solutions. Again, I invite everyone to take knowledge of the content of this report. It is very, very rich in information. So again, it goes back to policies, either developing the right policies in our countries or updating existing policies. We heard that we know the solutions that work, so we need really to look into them and see how we can adapt those into our countries, implement and enforce, because it's not just about having policies. Many of our countries have the relevant policies in drawers, but not really implemented. So we need to implement and enforce, continuous monitoring of that implementation to see a level of progress accomplished and adjust as needed. I'm not going to stand here for too long. So once again, thank you so much for the fantastic job that you did, for your presence, your dedication and commitment to support this important aspect. Thank you so much to the panelists for the fantastic comments and inputs and insight that you provided into what you all do. Thank you.
Thank you, sir. Appreciate it. Ladies and gentlemen, we've come to the end of our program. This is just to thank you all for your time, for you to be here as well today, vis-a-vis the whole situation that's happening in Nairobi. I want to thank you, all our partners, all our friends, all our online audience who've joined us. I'm told the report is online as well. It's live. You can download and engage with it as well. We've been live on the WHO Africa YouTube page. Please just get a few details if you can. Engage with us as well online. At this point in time, the formal bit of the program is done, and I'd like to wrap up the online bit of the program. We're now getting to, please give yourselves a round of applause for being here. I think that marks the end of our formal bit of the program. My name is Laban Cliff. I've been your MC. Thank you so much. Breakfast is still served, so please stay on, engage with the partners who are also in the room. Allow me now to start the photo session and just to guide us into the next steps. So, Twist, over to you. There are various partners in the room. I'd just like to keep on standby. We'll first take the first picture with the panelists. The first picture will be of the panelists and the moderator, of course. The first picture will be of the panelists. The second picture will be of the WHO team from Kenya and from the Africa region. So please be on standby. I think you can maybe just be somewhere on my left side there. The other picture will be of the Science Africa team. We have a team of journalists from across Africa, Kenya, Uganda. We have from Rwanda, Ethiopia. So we'd like to appreciate you. Thank you for being here. So we'll take a photo with you. We also have representative from the Office of the First Lady, their team that's coming there. So first picture, please. Please, can we get the media banner? If I could get the media banner on stage. Fantastic. All right. Let me have the panelists on stage, please. The panelists. I'll follow the guidance of Twist and the colleagues for this photo ops. Thank you, panelists. Thank you. I'll have Dr. Kiara still stay on stage. Let me invite the Director General, NTSA. DG, please come up. Let me invite as well, back up on stage, the WHO representative as well, Kenya. Please come up. Dr. Isaac Bashir, please come up. Hold on, as the team is on stage, let me invite WHO Kenya team. Kenya and Africa team. Sorry, I know you're quite a number, but please welcome, welcome Greg, Binta, Karibu, Emily, thank you. Thank you all for being here. Dr. Nato as well. Thank you. Thank you for the great work. Oliver, pull your cue. Thank you. I'll still have the principals stay on stage. The principals, please stay on stage. A representation from the Office of the First Lady. There's a representation from the Office of the First Lady. Thank you for the great support from the Executive Office of the President. Thank you. Thank you very much. Ladies and gentlemen, let me also welcome the NTSA leadership. Let me also welcome Superintendent Boniface Otieno. Please come up. Welcome, sir. NTSA's senior leaders. Thank you, Duncan. Dido. All right, NTSA's senior leaders together with representation from the Nairobi Traffic Unit. Thank you. Thank you. Science Africa team, I know you're kind of number. Please be on standby. Can you please stand? Science Africa team, if you could just come and queue on this side, queue on my right, while I have the principals come down. Side, sir. Yes, please, Dr. Kiara, the principals, please come down. I'd like to take a picture. As Science Africa team goes on the podium, the entire Science Africa team, please get onto the podium. Thank you. Asante Bwana DG, umeelewa? Sawa sawa. DG, please. Boniface Superintendent, please join us for this. Come on this side. Yep. Science Africa team to be on the podium. Yeah, sure, please. Thank you. Greg, please, the entire WHO team. Greg, Jemima, please come. The WHO Africa office, please come for this picture as well. Hold on. To the principals, if you could just kindly cue this side. This is the last photo. This is the last photo, sir. If you could just. Dr. Kiara, this is the last picture. Sorry to. Okay. Are you ready? Are you ready? Okay, I need a good chair. Sorry, we have the best of the journalists in Africa. So if I ask you to pose for these pictures, please bear with me. I know we all want very good coverage out of this. So I want to make sure that you're all seen and visible. I now would want to throw a chair. Okay, let's all first smile for the camera as well. And now in 3, 2, 1, hip, hip. Hip, hip. Oh, goodness. Thank you so much. I'm grateful. Thank you all very much. We are now done with the photo ops. Enjoy yourselves. Have a good day ahead.